Welcome to BizTech's Health and Wellness Show, the show where we equip you with health-related knowledge to help you to lead a more healthy and productive lifestyle. Now, our conversation today is about floaters, an early sign of potential blindness. Now, to bring an expert lens, with pun intended, to this topic, we have Dr. Musha Mustafa, ophthalmologist and vitreoretinal surgeon from KPJ Ampang Puteri. Now, this conversation is in partnership with KPJ Ampang Puteri Specialist Hospital. Now, Dr. Musha, welcome to the show.
Hi, Brian. Hi, thank you.
Now, for a start, Dr. Musha, can you tell us a little bit more about yourself and your specialty?
First of all, I would like to thank Brian for having me here. My name is Musha Mustafa, and I am currently practicing in Ampang Puteri. I am an eye surgeon and also retinal surgeon. I started my career in 2000, graduated from UKM, and followed with my postgraduate training as a specialist in 2007. That was also in UKM, and I continued with my subspecialty training, which is the retinal surgery. That is another 3 years after you graduated as a specialist. So that was in locally in KL as well as in Melbourne, Australia. So that was in 2013. So that was about 10 years ago. I was a lecturer, actually a lecturer and also consultant in UKM, the National University of Malaysia, for almost 15 years. And just recently joined Ampang Puteri as an eye doctor and also retinal surgeon.
So, Doc, you look really young, even though you've been practicing for 22 years. Now, could you tell us, first of all, for the benefit of the audience, the difference between a general ophthalmologist and a vitreoretinal surgeon?
First of all, when you become an eye doctor, everybody has the medical degree. When you become a general ophthalmologist, you are able to treat all these cataract cases, mainly all these basic general ophthalmology cases. But when it comes to complex kind of surgery, complex diseases, that is where I will come in. Not to say that I don't do general ophthalmology, I do a lot of cataracts as well. But on top of that, I also do the retinal cases.
All right. Now, the topic for today is really around eye floaters. Can you tell us a little bit about what eye floaters are and what are the causes of it?
Before that, Brian, just allow me to highlight why do I choose this particular topic. Sure. Mainly because it is very common. It's part of aging, yes, but a lot of patients come at a very late stage. And I always wish, if a patient can come much earlier, where things are not so complex, where the outcome of surgery will be much, much better. But that is why I'm taking this opportunity to actually, share the importance of not ignoring floaters. Now, what is floaters? Floaters is basically when someone sees something, an object in front of their eyes, moving when the eye moves. So basically, it is something like seeing something floating within your visual field. So when you look straight, you can see something is there. When you look to the right, you can still also see something. The same object is actually moving. So in actual fact, there's actually nothing in front of your eyes. It is actually inside the eye. It's in front of the retina, correct. So that's why we call floaters, because it floats within your visual field.
Now, can this happen with one eye only or both eyes at the same time?
Usually occurs both eyes, but probably one eye will precede the other eye. Very rarely, it can also happen in both eyes. It's just a matter of timing, when will it happen?
Now, are eye floaters an alarm bell or a canary in the coal mine in terms of early warning that perhaps we are heading towards blindness?
Now, the reason why I would like to highlight what is floaters issue. Now, there are two causes of floaters basically. They're the benign, the non-dangerous kind of floaters, the aging type of floaters. But I also want to highlight about the disease cause of floaters. So that is where we're going to lead to, because that is the one that causes blindness. So hopefully at the end of our discussion, we are able to assist our audience on how to differentiate and what to do when you see the floaters.
Okay, so let's take an example. What are some of the key factors that increase the risk of eye floaters? I mean, is it lifestyle related? Is it age related? Walk us through some of those issues.
Floaters are normal aging process. That's number one. It happens to everyone.
So we can't run away from that.
Not yet for you. Not yet for you. Not yet for you. It happens beyond 60 years old. If you ask all these old people, most of them will say they have something floating. It's just that they don't tell you because it does not disturb their vision. All right? It's a certain characteristic of the floaters which is very fine and they can sort of ignore most of the time. So that is why, it is, number one, is normal aging process. You cannot avoid it, As if you're having white hair, you cannot avoid the chances of you having floaters.
Okay, so this is inevitable. So the ways that perhaps we can slow the process.
When you have that aging part of your gel, okay, do you want to go to why you get floaters or normal?
Yes, because I think that's very important.
Yes, because I know where we always think like it's like cataract. Can we avoid it? No, unfortunately. Can we delay it? Yes, for certain, certain things, but not all the time now. Can you just show this to you?
Yes.
Now, this is our normal eye. So this is our pupil, right? When people talk about cataract, there's something here at the front, okay? Sitting behind the pupil, all right? But when you talk about retina, it's this yellow stuff behind here. So this is the back part of the eye, this is the front part of the eye. So when we talk about this aging process of the gel, I'm talking about the gel that sits here in the middle.
Mm-hmm.
So this gel is supposed to be very solid when you're young, all right? It's like a jelly structure. But then when we are aging, because the gel is made up of collagen. If you can imagine, when you're getting old, you lose all this collagen, so it shrinks, it becomes semi-solid. So when it starts to move, you know what I mean? Unfortunately, there's one thing that make it dangerous is because the gel does not float freely in the eye. It's sort of attached to your retina at the same time. So because of that, 90% of patients are fine. Most of them, they age gracefully, nothing happened. But then 5% of patients might have a bit of complication of this aging process. If you imagine the gel was actually attaching to the retina, so what happened is when the gel contracts, it pulls any part of the retina.
So tell us more then, doctor. What happens then? What is the complications? Let's zoom in on the 10% first.
Yes, correct. Now, the normal aging kind of floaters, usually the patient will say they are single floater, one single floater. They can actually count the floaters. The shape-wise can be either cobweb, spider web, it can be what we call a mosquito-like, it can be a string-like. So those are the common, what we call aging kind of floaters. Usually, patient will not feel, the vision will be good. There will be no flashes of light. That's another term that I'm going to introduce later because that's a very important scenario. Floaters without flashes is probably okay, but when you have flashes, there is a disease part, okay? Right, so the normal aging floaters, they have single floater, they can describe the shape, the vision is good, no other symptom. So that is a normal 95% of kind of floaters you're talking about. This kind of floaters is when it is more or less more than one, can be uncountable, can be dots, even though the vision can be still perfectly good. So those are the disease kind of floaters that potentially can lead to blindness.
So can we drill down a little bit more and help us understand with eye floaters and flashes?
Mm-hmm.
What's the impact then and what should we do?
Okay, let me just tell you the common disease that related to floaters. So then I tell you the sequelae so you can understand why you're having that. Okay, it starts, imagine that gel is solid there and becomes liquefied, right? So it also pulls on your retina when it contracts, when it shrinks. So what happens is, the first thing that patient will realize is the occurrence of flashes of light. It starts with flashes of light, usually. That most of the time we can ignore. And usually it happens in a dark room, occasionally, not all the time, and that process may take about a week or two. Okay. Ideally, we should, if possible, if the patient can come immediately during that time. Okay, that is the early sign that there's a traction on your nerve. Okay, number one. The episode of flashes of light, then only patient will start to see floaters. All right, so that is a sequelae usually. After floaters, then they will start to see, the vision can still be good, but they will start to see that some part of their visual field is actually dark. Despite being able to see, they will say like, I can't see this part, I can't see that corner.
Ah, I see. So the vision starts to be constrained already.
Correct. And slowly, if you don't do anything, that is when it will affect your center part of your vision.
So, doctor, then I'm in that situation now. Obviously, my eye is diseased. What are the surgical and non-surgical options open to me?
Okay, if let's say the patient comes at the stage of flashes, the stage of floaters. Okay, now before you go to surgical treatment or the treatment, let me tell you what happened. When let's say there's a traction on the retina, so what happened is one part of retina will be torn off. All right, the moment you get that tear on the retina, these two layers, you can see there's many layers there, splitted up. So there is a sequelae. You get flashes, floaters, and you get retinal detachment. All right, so we try to actually, if possible, we want to see the patient at the flashes and floaters stage. That is when there's only tear without detachment. So at that stage, you do not need any surgery. All you need just a simple laser, using our machine here like this, very simple machine like this. You don't have to go into operation theater, and we just do laser about 5 to 10 minutes, and that's it, all job done.
Okay, and how long does it take to recover from that?
The floaters doesn't go off too fast. We don't do anything about the floaters. The floaters is just a sign, all right? Because the floaters will go off slowly because there is a drainage system inside the eye that will get rid of the floaters. Depends on how bad is the floaters. Yeah. So I mean, the floaters is just a sign to us that we have to treat, and slowly we go off even though you don't treat.
Okay. So then, however, what are if that cannot be solved simply, what are the surgical options?
Okay, when you have flashes and floaters, but you did not. Okay, let's say when you have flashes and floaters, there are early signs, you go laser, but then when you already have detachment, you have no choice but to do a surgery. Now, if you have only flashes and floaters and laser, the recovery is very fast. You can go back to work immediately. Or sometimes we ask them probably to have a rest for 1 week because the laser will only take effect after a week or two. It doesn't sort of adhere strongly to the laser that we give the patient. The effect of the laser will only set in about a week or two. So we usually give them probably a week and MC. But then when it comes to surgery, recovery takes months. So that is when we say, if possible, if you have flashes or floaters, come immediately on the same day. If you have the flashes or floaters tonight, go and see your eye doctor the next day. Don't wait for a week. Don't even wait for 1 week, if possible.
So, doctor, in KPJ Ampang Puteri itself, what sort of facilities do you have, and what sort of timelines do you have in terms of booking ourselves in for treatments or surgeries?
In Ampang Puteri, I have to say that KPJ has been, willingly support. KPJ has been investing a lot when it comes to all these advanced surgery. Even for the laser type of surgery, our laser machine is one of the most advanced laser machine, very precise. And when it comes to surgery, we have also the latest model for the surgery itself. I get into the surgery because the surgery nowadays is much better than a few years back. And what we have here is a small, small incision surgery, a sutureless surgery we're talking about.
Okay, so that obviously, I would assume that because it's less invasive, the recovery time is faster.
A bit faster.
And overall outcomes, are they better because obviously there's less, it's less invasive?
It is. I'm not saying it's less invasive, but it's a small incision.
Okay.
All right. Small incision means faster healing.
Okay.
Faster healing, less complex. It simplifies the surgery. Of course, if the disease is early, it is simplified. If it's a chronic disease, it's not so simple.
Mm-hmm.
So that is like, I really wish a lot of patients comes very early. The scenario is, number one, patient did not realize it is actually, they didn't realize that flashes and floaters are dangerous, so they only see the eye doctor probably a week or 1 month later. So by then, they already have detachment, So number one, you have no choice of surgery. You have no option of doing laser anymore at that particular stage. You just
I
have to do
see.
surgery, And number two, the scenario in Malaysia is, we have two eyes, right? Most of us do not realize what happened to one eye. It is more of, oh, I accidentally closed the eye and I didn't, then only I realized I really can't see with the other eye, And that is very common, especially in the aging population. So a lot of our patient comes when it's very chronic.
I see. Dr. Musha, but that's a broader problem, is it? It's not just a Malaysian problem, but for us really in Southeast Asia, we don't perhaps give as much attention to our eyes as we should, because a lot of times the optometrist is probably the only person that we visit, probably if we have any sort of issues, and many of us have issues. Like myself as a teenager, I had to wear glasses. That's our principal point of contact, and we go to an optometrist every time we want to get new contact lenses or get new glasses. But that stops there. I think that's a broader problem.
It doesn't really stop there, Brian, because we do work very well with the optometrist. They refer cases to us. When they check the power, let's say your glasses whatsoever, whenever they could not correct your vision, they would definitely refer the patients to us. So it's good as well that the community has a very close contact with the optometrist, right?
Okay, so there is a case. So myself in particular, so let me share an example. So I've been wearing glasses since probably I was about 17 or 18 years old.
Okay.
I after listening to this, I'm startingly realizing that I've actually not been to an ophthalmologist at all to check my eyes. And perhaps after this, I think this is something, after this conversation, I need to do that. I'm 52 years old. I probably need to go and check my eyes and see what the state of my eye health is.
It's interesting, but I don't know whether you're going to edit that. It's interesting because I came from a university, right? So we do always do these studies. 85% of our patients come after the second eye is involved. Can you imagine that?
Wow.
That is for the aging. It can be as bad as that. That is for certain disease, let's say a chronic disease like age-related macular degeneration. There is a scenario in our country at the moment. 80 to 85% comes after the second eye is involved.
I see. So, Doc, what are some of the best practices and advice that you can share with the audience in terms of looking after our eyes?
We always say to the patient, if let's say you don't have any medical disease, let's say you're fit and well, after 50 years old, actually after 40 years old, at least you need to get your eye checked at least once. And after that, if let's say everything's normal, we still advocate them to come, every 2 years at least. So because remember, because of the issue of we have two eyes, you didn't realize what happened to the other eye.
Correct.
Right? And number two is when there's any changes, any new symptoms, anything which is not normal, flashes, floaters, a bit of pain, a bit of drop in vision, a bit of crooked line, maybe seeing crooked lines, so any kind of problem, don't wait until next week. You have to go immediately for not only for this retinal issue, for any eye issues, because you have to remember, eye is full of nerve. So it's not a skin layer, it is mainly nerves we're talking about. You need to treat them urgently.
On that note, Dr. Musha, thank you very much for taking your time to come on the show.
No worries. Thank you, Brian.
Now, I'm Brian Fernandez, and we've been speaking to Dr. Musha Mustafa, the ophthalmologist and vitreoretinal surgeon at KPJ Ampang Puteri Specialist Hospital. Now, on BizTech's Health and Wellness Show, in partnership with KPJ Ampang Puteri Specialist Hospital. This video and podcast will be on our social media platforms, as well as our website, www.biztech.asia. Please like and subscribe to our various platforms. Thanks again for tuning in.